Thank you so much for studying along with me today. My name is Dr. Meredith Watkins, and I'm here to make nursing content easy and straightforward and easy to understand. As we study this topic today of ethical principles for mental health nursing, be sure you follow along in the Mental Health Study Buddy. The link is in the description below. With that being said, let's get started. We have just 3 simple learning objectives for today. We're going to talk about the Nursing Code of Ethics, talk about ethical principles related to mental health care for nurses, and describe approaches to an ethical dilemma. So what is ethics? Well, ethics is the study of morality through a variety of different lenses or approaches. And a person's ethics can really say a lot about their core values and beliefs. Now, ethics can be applied and considered in a variety of different settings. Society ethics, different organizations have their own set of ethics, bioethics, also known as clinical ethics, professional ethics, and personal ethics. And there's some kind of overlap here when we're talking about mental health nursing and ethical principles. We're thinking about the nursing profession and the professional guidance of nurses. We're also thinking about our personal ethics and how we bring that into the clinical setting. We're thinking about the organizations we work for and the values that they hold, and then the ethics of bioethics as well. So there's a lot of overlap here and certainly a lot to unpack. So let's get into it. Here's an example of the main bioethical principles that we apply in mental health nursing. Non-maleficence means not doing any harm. So we want to avoid doing things that are going to be harmful for the patient. Beneficence means things that benefit the patient, doing actions that are going to be for the patient's good. Justice means fair application and availability of resources. So we want to make sure that every patient has good access to mental health care and equal access to treatments and therapies to help them along their journey. Fidelity means faithfulness. It means doing what you say you're going to do. And so if you tell a patient that you're going to be back in 10 minutes, then you better be back in 10 minutes. Autonomy means someone has the ability to choose their own choices in life and make their own decisions. And sometimes in mental health care, we take that autonomy away for the sake of the patient's safety or the safety of those around the patient. So we want to be very careful with that. And then finally, veracity is truth-telling, making sure that we're being honest with the patients and telling them the truth. Here are some of the main bioethical or clinical ethical issues that come up in mental health nursing. The choice to use or not use a restraint in a situation, whether it's physical or chemical. Considering the quality of a patient's life and what we can do to improve it. Protecting the patient's rights and the dignity of the patient as you're dealing with patients in mental health crisis. Respecting the client's informed consent. Being a part of policy making that provides quality care and equal care for all patients. And then there's considerations of workplace safety with things like understaffing and unsafe working conditions. All of these factors play into ethical issues that arise in mental health nursing. Here is the aspect of social justice and mental health nursing. Stigma is still very real and very present in healthcare. Patients with severe mental illnesses, even if they're not coming in for that issue, may be treated differently by their providers and healthcare staff. It's important that we avoid prejudging people and stereotyping patients with mental illness, and that we take care of them and listen to what's going on today. Adverse childhood events are one of the most common causes of mental health illnesses. Patients who experience trauma as a child, whether that's having a parent that's incarcerated or being abused or neglected or living in a violent community, all of those things can predispose patients to having mental illness and having poorer outcomes with their mental illness. Health disparities, vulnerable populations, the underserved populations, minority populations, all face higher risks for mental health illnesses. So it's important as nurses that we do the work of eliminating systemic racism, decreasing stigma in mental illness, and increasing the justice, the equal rights and access to mental health care in this country. So when you're making an ethical decision, how do you go through that if there's an ethical dilemma at work or there's a patient situation that just doesn't sit right to you? Well, first of all, never make ethical decisions alone. We work with a team to make ethical decisions. In fact, hospitals typically have an ethics board where you can make referrals to have a decision made by a team. Make sure you're following your policies. The policies that hospitals write are there to protect the patient. Utilize your chain of command. If something isn't sitting right with you in the way a patient is being treated, or if you're worried about their rights, utilize your chain of command to escalate that situation. Clarify your own personal values. What are the things that you value as a nurse, and how do you align with those values in your workplace? And you can, again, make an ethics committee referral. If something's not fitting right and it just doesn't seem like the patient's rights or ethics are being applied, you can always make an ethics referral to have a larger group of people who aren't involved in the situation look at the situation and make some decisions. There are a number of organizations and directives that could help guide us as nurses to make ethical principles and make ethical decisions. The first is the ANA, the American Nurses Association. The ANA sets standards and scope of practice for nurses and gives us parameters as to what our role is. The second is the Mental Health Care Act of 2017. This act decriminalized suicide, restricted the use of electroconvulsive therapies and psychosurgeries to limited use, has a special clause for women and children and related to admission, treatment, sanitation, and personal hygiene, and gives a provision to have advanced directives for psychiatric care. And finally, the Nursing Code of Ethics gives guidance on ethical behaviors of the nurse. So let's talk a little bit more about the Code of Ethics. The purpose of the Nursing Code of Ethics is to guide nursing practice, to help us navigate ethical dilemmas, that means problems, challenges, and to help us understand the nursing obligations to both the client and society as the whole. Now, the Nursing Code of Ethics has 9 standards for nursing ethics. The first is to honor human dignity. The next is that our primary obligation is to the client. It's not to the client's family. It's not even to your organization. Your primary duty and obligation is to the patient. The third is to advocate for the client's health and safety. The fourth is that we as nurses need to be responsible for our own action and take accountability. The fifth is that we have professional integrity and that we seek to be lifelong learners, that we seek professional growth so that our patients are getting the best care from us. Number 6 is to provide quality patient care. 7 is to help advance the nursing profession as a whole. 8 is to contribute to solutions of broad health crises and issues. This could be things like contributing to reducing ACEs, those adverse childhood events, or targeting the opioid crisis in our country. And then finally, the last directive is actually listed toward the nursing organizations that help guide us. And that is that professional nursing organizations should be committed to the integrity of the nursing practice. I hope that these code of ethics kind of help guide your practice as a nurse and give you a framework in which to practice. When you ask a nursing student why they went into nursing in the first place, 9 out of 10 times it's because people say, I want to help people. Ethical principles will help guide us to be able to do our best to help patients because sometimes the situations can get sticky and these will give us direction. Thank you so much for studying with me today. Remember, you are smart, you are capable, you are loved, and you got this. I'll see you next time.